Spectrum Hospital is one of only 6 burn centers in the United States to introduce a new burn survivor care kit. The Journey Forward kit is meant to help burn survivors transition from the hospital to home. It's the creation of the Phoenix Society for Burn Survivors. CEO Amy Acton is here now to tell us more about it. Amy, thanks so much for being here.
Thanks so much. Great to be here, Michelle.
You know, we know that leaving the hospital and then returning home can be a really difficult time, and this is meant to help that.
Yes, absolutely. For burn survivors, we found it's one of the most critical times, and we did a really extensive survey of the population, and leaving the hospital and knowing what's next is one of the biggest struggles.
And you found that a lot of burn survivors felt like they didn't have some of that support.
That's correct. I think it was 66% of the people didn't know what to expect in the recovery after leaving the hospital. There's just so much information, and the physical healing is still happening, and there's a lot of things that they have to kind of retain. And so not hearing some of the instructions is happening. There's a lot of factors to that. So we wanted to connect them with a very tangible box of information that they could reach to when they were struggling.
So there are actual tangible items, like you say, but along with connections to local and national resources, what is in the kit?
Yeah, so what is in the kit is there's literally a little journey map that helps them kind of know what are some of the things that they can expect in the next few months, and the kind of that first year picture. So there's a literal journey map. There's a special journey magazine that is written by survivors and loved ones, sharing information and advice and tools that they used during that period of time that were helpful to them, and understanding that there's a whole community there that they can reach out to. There's tangible things like lotions, which we all need as we're healing from burn injuries. Our skin gets dry, so there's kind of a sampling of various lotions. We have a kind of a unique item in there called dermatherapy pillowcases and a flat sheet, because it's a FDA cleared and patented kind of silk-like sheet that reduces friction and helps with sweating and things like that. So real tangible things are in the box, and a few other kind of trinkets, a tumbler with a straw, because some people can't, pick up a glass at that time yet, and some other items in the box.
All things that can be really important to some burn survivors. How'd you pick the hospitals that are piloting this program, including Spectrum here in Grand Rapids?
Yeah, well, we wanted to pick a variety of hospitals, different sizes, and we had different methods that we're trying to test to get the box to the actual survivor and family members. So we did geographic regions. We have Orlando Regional Medical down in Orlando, Florida, Mass General, Spectrum Health here in Grand Rapids, UCI Irving Regional Burn Center in Orange County, California, University Medical Center in New Orleans, and the Medical Center of Southern Nevada. So we try to get geographic and size of the burn centers. And obviously Spectrum's right here in town, so we felt it would be great for us, since we're a national organization here headquartered in Grand Rapids, to be able to walk over and have conversations with the clinicians on how this is working.
Yeah, and I would imagine that after these 6 initial programs, you'll try to expand.
Yes, our goal is, there's about 120 burn centers in North America, and our goal is to get into all of them. And this is beyond the kit. It's a program really to focus our efforts on that transition from acute care to home, and then ultimately to successful living with a burn injury.
All right, good. Well, we really appreciate the information. Looking forward to see how it works. Thanks so much.
Thanks so much for having us.